how does MCAS impact pelvic pain conditions like endometriosis and just vulvodynia, vestibulodynia, any type of vulvar pain?
I'll definitely speak to the vulvodynia aspect. So our understanding of this, how this trifecta leads to vulvar pain, is definitely evolving. It's a focus of research in our practice. What we understand about MCAS is that one of the ways that it leads to vulvar pain is at the tissue level, where these mast cells are communicating with superficial nerve endings, and they're leading to a process called neuroproliferation. So there are new nerve endings growing, specifically in a tissue called the vestibule, which is a ring of tissue that's between the external genitalia, which is the vulva, and the internal, which is the vaginal canal. The diagnosis is called neuroproliferative vestibulodynia. So Odine was the Greek goddess of pain. Vestibule means entrance. So this is pain at the entrance. Mast cells are our first line of defense against pathogens and allergens, and they're abundant in tissues that have exposure to this external environment, like the skin and the GI tract and the lungs, and mast cell associated disorders that occur in these areas are like eczema or asthma or GERD. And in the vulva, when the vulva is exposed to yeast or allergens, they can be activated and they stimulate this immune response and release of chemical signaling, which causes redness and pain and swelling and itch. These are all familiar signs of infection or allergic response. But one of the chemical signals that they release is called nerve growth factor. It stimulates these new nerve endings to sprout within 1 to 3 millimeters of the surface of the skin. And when mast cells are chronically activated or overactive, it results in pain that persists after the infection is cleared or after the exposure to the allergen is gone. There's also a theory that you can be born with too many nerve endings, or that you may have been exposed to some mast cell trigger at an early age. And if that's the case, you may have pain with tampons or intercourse or speculum exams from forever. So it's never been pain-free. These nerve endings are specifically responsible for rawness, burning, and cutting sensations. So it can feel like a hot knife with light touch, but the skin itself generally looks normal. The most successful treatment we have is a vestibulectomy. And this is when we remove the tissue in the vestibule and we replace it with vaginal tissue, which is interestingly not susceptible to this process. And when we do send out these tissue to pathology, it shows increased nerve density and increased mast cells. So we know that this process is occurring. Research is really focused now on finding non-surgical options. Before we talk about research, I think that there are several pathways that can lead to vulvar pain that are related to the trifecta, and hypermobility and POTS. So we're looking for nerve and vessels and muscles that go to the vulva and cause pain. There's not one cause that applies to everyone. Not to make this more complicated, but more to emphasize the importance of having an exam, so that we can identify where the pain is coming from. Because sometimes we can ask all the right questions and know your history, but an exam is really important to make a good diagnosis. And I think that it's very important also to be treating the whole body, and that can improve your vulvar pain a significant amount. But if you still have continued vulvar pain, there's also mast cell treatments specific to the vulva that we can address with you. Part of our job is also helping you find the right people. So we're screening all of our new patients for hypermobility, MCAS, POTS, and endometriosis. And I like this panel. I hope it helps people understand who they need to see and prioritize where they need to go. I think that we are excited about collecting all of these information from on our question. All of our patients who fill out questionnaires come to our practice, fill out questionnaires, and we're gathering more data on how these are overlapping specifically for vulvar pain. And so more to come, hopefully soon.